Hi, this is Dr. Ikram Hansulzai. Today I'm going to share a code case of left ovarian cyst. The size of cyst was 65 into 49 into 62 mm and causing discomfort and pain to patient almost from 5 to 6 months. And this was not a simple cyst. It was a hemorrhagic cyst where actually cyst is a fluid-filled sac, and in a hemorrhagic cyst, when the blood vessels in the that sac ruptures and there is bleeding, so what we call it hemorrhagic cyst. So many cysts of small size go its own, but large cysts, especially hemorrhagic cyst, can cause further complication and cause, in few cases, an emergency condition. So this patient visit my clinic with sharp pain on left side, and as in homeopathy, it is a very basic principles that with the pathological findings we consider whole. We are prescribing for whole instead of part. So what we call, we treat patient in disease, not disease in patient. So with pathological findings, we have to ask few general questions regarding general health of the patient. Like what about thirst, appetite, sleep, bowel movements, desires and aversions, patient mental dispositions, and there is any emotional cause or anything fearful or anxious for patient. So these all sort of things are helpful for selecting remedy for us. So uh, this ultrasound report was on 3rd of October 2022, and hemorrhagic left ovarian cyst. So a pathological finder also suggests CA125 blood test, which is a tumor marker of cancer. So I also recommend this test, but CA125 was normal. So in mostly these cysts are non-cancerous, but few cases that can be cancerous. So that's why I also recommend CA125 blood test, which was quite normal. So here we go. On 17 December 2022, you can see here, zoom in. Okay. Now you can see thick walled urinary bladder with echogenic debris, cystitis urinary correlation is registered. I also did urinary, which was quite normal. So in left ovary is quite normal now. There is no hemorrhagic cyst, and very important, the condition of the patient was also quite normal. So come up with patient's situation. So this was a case, and what I said, you people, we treat patient in disease, not disease in patient. So I observe our patient, how our patient is talking, what are mental dispositions of the patient. So these all sort of things are helpful for prescribing us, because our medicines have been proved on animals, on healthy individuals in preclinical trials. Okay, so every drug, everything have effect on mental, emotional, physiological plan. That's why we have to match patient's totality of symptom, which includes mental, emotional, and physiological makeup of the disease with drug totality of symptom. Okay, so patient was fastidious, introverted, reserved, and very sensitive to noise, and there was a problem with the right nostril, which was blocked, and was flatulence after eating, and itching, rectum itching after stool, and she was constipated, very chronic licoria, constant chronic licoria, which causes itching, and uh, as you people know, a hemorrhagic cyst can cause pelvic pain, can cause dysmenorrhea, okay, can cause flatulence, the distension in abdomen. So these are all sort of pathological symptoms. And I took general rubric: female tumors, cysts, ovaries, and sleep position side on left. Generality is food and drink, salt or salt reason. So I prescribe natriumur, and after 15 days on slight relaxation of the symptom, I repeat again natriumur, and patient was on placebo after that. And on from 3 October to 17 December, you can see test report was quite normal, and homeopathy can help such cases very well. Homeopathy have prolonged have a very prolonged effect on diseases. It's not all about that you prescribe remedy and for a month or 2 months your patient is good and after that condition is less. No, not at all. Homeopathy provides you a complete cure, which is permanent restoration of the health. So subscribe my YouTube channel for further information and updates. Thank you so much.